Welcome all. Welcome to this AimExcellence 2019 NEET PG fast track discussion. And yesterday this particular brochure came in, and today I've seen the number distribution and also the few videos which rightly pointed out the subtle differences in the number distribution with the last year. Many eminent mentors have actually pointed out, dissected this particular brochure perfectly and pointed the subtle differences. So first thing, there are some subtle differences out there in the number distribution. This is the first thing. Like the preclinical subjects are actually comprising 50 questions instead of 45 questions last year. The core of the paraclinical subject like pathology, pharmacology and microbiology actually remain the same. Also the PSM. So there is not much difference, and also the forensic medicine remains the same. And if we calculate it properly, the preclinical and paraclinical subjects right now is comprising 50% of the questions, 150 questions. But important thing is there which I really focused on actually caught my attention is the obstetric and gynecology, which is having 30 questions. The general surgery is clubbed with the orthopedics, anesthesia and radiology, which is 45 questions, and general medicine actually including dermatology and psychiatry, which are the 45 questions. So less number of questions are from dermatology and psychiatry are expected. Less number of questions from orthopedics and anesthesia is expected, and more questions we can expect from the obstetric and gynecology. It seems they are actually following the final MB syllabus while setting up this number distribution. So you can expect more core medicine question, more core general surgery questions, and more obstetric and gynecology question. So those people who are studying from Harrison, Lavenbelli and DC Datta or Jeffcott or Williams, they are going to have an advantage. Also Nelson and Opighai. Now, while there is 150 questions from preclinical and paraclinical subject, why I am saying so? I feel the focus is to make clinician. If you see the change in the subject in different seat in the different subjects, you will find number of seats are increasing in the clinical subjects. So what you can expect? Clinical subjects. There will be integration. In the question there can be integration. Just like our palsy with Potter deformity, they can actually ask you about where the injury is going to happen. So this is the integration between the orthopedics and anatomy. Like in dermatology, a case of Norwegian scabies, they actually can ask you by giving a histopathology picture, what is the drug of choice. So that can be either can be a pathology question or a pharmacology question, can be seen as that. Like from the scrap typhus, or Rocky Mountain spotted fever, they can give a question where they can ask you the drug of choice. Similarly, from the Gaucher disease, they either can ask you which is going to have the which type is more severe, which is more common, or can give the histopathological picture, can ask you about the orphan drugs, if you haven't seen the video that we have uploaded, you must check it out. We have actually given the entire Gaucher disease. So these are the questions that is actually going to be in integrated fashion. So those people who are actually have pretty good holding over the changes in Harrison 20 edition, they will and might have an edge. Similarly, it also applies to the who are going to have the Bailey 27th edition. Following the recent guidelines, like the changes that is being given in the carcinoma cervix, those things has to be in fingertips. So if you think this particular presentation is going to help you and act as a positive catalyst, please write to us. And we should give a credit to NBE for shifting the timing, because first week of January is a horrendous time in northern part of India, and at the 6 o'clock in the morning or 7 o'clock in the morning to be ready and to go to the examination center amidst the fog and the pollution, it's a risk in itself. So it's a very good thing. They have empathized to the condition and the challenges a student is going to face, and kudos for that. It's a great thing that they actually empathize with the challenges a aspirant is going to face, and hopefully at the new timing is going to help many people. If you like this particular presentation, if you think this particular presentation is going to help you a little in your upcoming examination, and the focus that we are strongly saying is going to be integrated question, there will be at least 8 to 10%, means 25 to 30 question will be image based question for sure, and we will really hope the question that we have uploaded, we have not given the repeat questions. I strongly feel out of the 300, even if 200 100 question comes which have been asked before, rest 200 will be new one. They know they have around 1.25 lakh people who are going to give the examination, so they know they just need 5 percentile of the aspirant, roughly 4 to 5% of the aspirant, to be in the top 95 percentile or above 2SD, and these are the people who are going to get clinical subjects, good clinical subjects in the government medical college, which is and which will remain the most coveted subjects and discipline for years ahead too. And as they are focusing on these subjects and increasing more seats in the clinical subjects, you can expect these 3 subjects are going to form the bulk. It's actually comprising 120 right now, but these particular subjects you should focus if you haven't focused till now, because these 3 subjects will make or break your the outcome. It will change the outcome of your examination. You start to focus on these subjects, you start to focus on Harrison 20th edition, you start to focus on Lavan Belly 27th edition, and also Williams latest editions. So these things are very, very important. And if you think this particular video have the inputs that is going to act as a positive catalyst for your upcoming examination, continue to follow us, and we might upload few NRB questions that we have uploaded almost for last 3-4 months, and hopefully this effort is going to act as positive catalyst in your upcoming examination. If you like this particular, you can wait, you actually can wait, you can see whatever we have said, how much it is going to be close to the truth itself, and how, if you find it, I hope you will appreciate the effort that have been made to dissect, to explore the subtle changes, and to try to read out the in between lines points, what the inner meaning they want to transmit in between lines. These are the important things which we have actually focused on while making this particular video, and hope this particular video is going to act as positive catalyst in your preparation. Thank you.